is Grace Mota. I work in the international development space. I work in the capacity of executive assistant to the leadership team. I'm really happy to be here at Humanitarian Global, attending the Leadership in Project Management for NGOs and International Organization training. This training has been really great because it's given me insight in my role supporting the program teams, but basically just understanding where my role fits in terms of project management. This training has been very instrumental. The facilitators have been amazing with the practical example that we have gained in this program, and I would encourage each and everyone who works in the development space to come and train with the humanitarian organization for this specific training.
Hello, hi everyone. My name is Sheilah. I'm part of the academics team here at Humanitarian Global. I'm happy that you're here, and I look forward to getting to learn a lot from you. With that, I think I will give a chance to the team at Humanitarian Global to be able to introduce themselves as we proceed. Brian?
So thank you, Sheilah, for granting me this opportunity to greet our good webinar participants. So yes, as Sheilah has mentioned, my name is Brian from Humanitarian Global, part of the technical team that ensures that this event is a success. So thank you, Sheilah, and thanks to everyone that has joined.
Great. Thank you so much, Brian, for that. As we move along, I also want to invite Susan to be able to just introduce herself, and then she'll come in later to be able to take us over through what CLTS is all about. Susan?
Thank you, Sheilah. Kindly confirm you can hear me.
Yes, we can hear you.
Thank you. Hello, everyone, and thank you for joining today's webinar. My name is Susan, and I will be taking you through the CLTS presentation today. I look forward to lots of interaction and participation from those who have been able to join. Thank you very much.
Yes, I want to bring on board, I want to bring back Brian to be able to tell us a bit of what is happening at Humanitarian Global, so that now we get to understand what is happening, what are some of the trainings that we currently have, what do we have in store, what do you need to and just Brian, over to you.
Sheilah, I hope I'm audible. I hope you can as well
yes,
see my screen,
audible.
Susan.
Yes, I can see a screen.
Okay, so thanks to everyone that has joined the webinar. And before we begin, we'd like to share with the audience the type of programs that we conduct. So yes, we are Humanitarian Global. We provide training and learning solutions for humanitarians and development practitioners. So you can visit our website. I'll share the link later on and get to go through the courses that we offer, including water, sanitation, and hygiene, which is an area that we are going to cover today. And I'd also like for you to explore some of the programs that we offer, including monitoring, evaluation, accountability, and learning, water, sanitation, and hygiene, which I believe most of you are interested in. We also have human nutrition and dietetics, a very important course. We have procurement and supply chain management. We also offer that. We also offer disaster risk reduction and management, which is a very popular area. And finally, last but not least, food security and nutrition in emergencies, which is also an important area. We also have maternal, infant, and young child nutrition. Yes, which is a very, very key area. So just to break down the water, sanitation, and hygiene, we offer it in 3 levels based on your understanding of the subject. We do have the certificate level, which we refer to as the beginner. So if you do not have any experience with the area of water, sanitation, and hygiene, public health, you can as well undertake the certificate level. For the people that have prior experience, we recommend you to undertake the diploma level, which is a bit deeper and digs deeper into the areas of water, sanitation, and hygiene in relation to public health. So finally, we do have the postgraduate diploma, which we refer to as the advanced level. This is for practitioners, people who are already practicing but would like to take their career to the next level. So I'll be sharing this link so that for those that would like to undertake this type of training can actually enroll and then join us in the month of October or in the month of the subsequent month, which is November. So you'll come to our website. There is an apply now link over there. Once you apply, we'll get your details and our team will be able to reach out to you. So if you're going to stay with me, we do have a couple of amazing events happening in the month of December. I would like just to highlight them for you. We do have the fundraising and resource mobilizations for NGOs, which is a very important area for practitioners that are interested in such a topic. So we do have the fundraising and resource mobilization. Also, if you're interested in that, reach out to us after the webinar or during the webinar. You can share your details in the chat sector, in the chat section, I mean, so that our team can be able to reach out after this event and guide you further on how you can register for that. We also do have the leadership and project management for NGOs, which is a very, very important area. It's related to aspects of monitoring and evaluation. So it's also an area that if you are interested, you can join us this December. It will be a very big workshop. So yes, those are the events that we currently have. And in case of anything, feel free to always follow us on social media, Facebook, our Facebook page, where most of you are from. You can follow us there so that you can always get updates on our upcoming events. So thank you very much. I'll be sharing the links below after I've finished this presentation, and then hopefully you guys can get to join us. So thank you. Thank you very much, Sheilah.
Great. Thank you so much, Brian, for that interesting pathway to what we have in store. I would want to really emphasize on the one that is happening in December. It will be a great time for you to visit Nairobi, just be able to Kenya in its own and see the magnificent things that we currently have. So take up the chance to come to Kenya to learn any aspect of fundraising as well as leadership, so that now you get to embark on tick 2 boxes in one. So with that, Raphael, you have a question. Please type all your questions on the Q&A section, so that now we'll be able to have a chance to be able to answer all those questions after Susan has completed. Again, drop in your comments even on the chat section, so that now we get to know you and get to also interact and participate fully in this webinar. With that, Susan, I believe this is your chance now to tell us what you have in store for us.
Right. So today we will go through the CLTS principles and practices. So today we'll be talking a lot about open defecation, or as practitioners in this sector like to refer to as SHIT. And that is basically what community-led total sanitation is. By definition, CLTS, or community-led total sanitation, is an innovative approach used to mobilize communities to eliminate open defecation through collective behavior change. The approach emphasizes local leadership, peer pressure, and community pride, rather than subsidies or external aid for sanitation infrastructure. So there are quite a number of definitions that one can use when referring to CLTS. The first that I just gave is a general definition. From a behavioral change perspective, CLTS is a behavior change approach that helps communities understand the dangers of open defecation and motivates them to work together to achieve total sanitation. It focuses on creating a triggering effect where community members realize the public health implications of their practices, leading to a collective decision to stop open defecation. The World Bank defines CLTS as a methodology for mobilizing communities to completely eliminate open defecation. And the practical implementation definition is that community-led total sanitation is a participatory method of empowering communities. At the beginning, it was mostly rural, but we have seen a lot of movement into the peri-urban areas to improve sanitation and hygiene through their own efforts. It does not provide subsidies for toilets, but instead encourages households to build and use their own latrines through a process of local problem solving and action. When you check on the Global Sanitation Fund definition of CLTS, it is defined as an approach that shifts the focus of sanitation programs from the construction of toilets to inspiring community-driven initiatives for ending open defecation. The key principle here being that behavior change should come from within the community, using social norms and collective action as a catalyst for improved sanitation practices. And finally, UNICEF defines CLTS as an approach to engaging communities in taking responsibility for improving their sanitation and hygiene. It focuses on triggering collective behavior change to stop open defecation, recognizing that access to sanitation is a fundamental human right. So what are the importances of community action in sanitation? Community involvement in sanitation is quite crucial for the success and sustainability of sanitation projects. When communities actively participate in the design, in the implementation, and the maintenance of sanitation facilities, this leads to long-term improvements in public health, environmental management, and overall well-being. So the first importance of CLTS would be sustainability of sanitation systems, in brackets, ownership and long-term maintenance. And when you talk about ownership, this is a situation where communities are involved in the development of sanitation systems. They take ownership of the projects, increasing their commitment to maintaining and using the facilities correctly. This will reduce dependency on external support and ensure that sanitation facilities are well maintained over time. So initiatives such as latrine construction and hygiene promotion are more likely to be sustainable since local people are invested in their success. They are more motivated to make repairs, to clean facilities, and ensure proper use when they have been part of the planning and construction process. The second importance is behavior change and adoption. Community participation encourages a shared understanding of the health risks associated with poor sanitation, such as open defecation. When the community is actively involved in education and awareness campaigns, there is definitely greater peer pressure and support for improved behaviors, leading to faster adoption of better hygiene practices. When it comes to social norms, community involvement helps establish new social norms around sanitation. So people are more likely to change their behavior when they see that their peers and neighbors are adopting new practices. And this collective approach helps break down traditional practices such as open defecation. A very big importance of sanitation, of course, is improved public health outcomes through the prevention of waterborne diseases, because poor sanitation is a major cause of waterborne diseases such as cholera, diarrhea, and dysentery. So when communities are involved in sanitation initiatives, they are better equipped to understand the link between hygiene, clean water, and health, leading to improved health outcomes. And this leads to a reduction in disease transmission. And CLTS has demonstrated effectiveness in reducing open defecation and improving hygiene practices, thereby decreasing the transmission of diseases. The fourth is cultural relevance and contextual appropriateness. So CLTS involves introducing tailor-made solutions or engaging the community to ensure that the sanitation solutions are culturally appropriate and reflect the community's needs and preferences. Communities often are able to provide valuable insights into local practices, beliefs, and barriers, allowing for the design of facilities that are more acceptable and usable in their specific context. CLTS also gives you the opportunity to respect local traditions by involving the community in decision-making in sanitation, so that the sanitation projects can align with cultural traditions and local social structures. This increases acceptance and the likelihood of using and maintaining the facilities. The fifth is empowerment and social inclusion. So community involvement, especially in inclusive approaches, ensures that all members of the community, including women, children, and marginalized groups, have a voice in decision-making. This empowerment leads to improved social cohesion and ensures that sanitation solutions address the needs of all individuals, not just the dominant groups. And when you talk about gender inclusion, sanitation issues disproportionately affect women and girls. So when women and girls are actively involved in sanitation projects, their unique needs such as menstrual hygiene management and safe hygiene, general hygiene are better addressed. Community involvement ensures that gender-sensitive facilities are built, contributing to improved well-being for women and girls. The sixth importance is effective use of resources. So there is an element of cost efficiency because when communities participate in the construction and maintenance of sanitation facilities, the costs of external labor, materials, and long-term upkeep are reduced. Communities are also able to mobilize local resources such as labor and locally available materials, making the project more affordable and easier to sustain. In terms of monitoring and accountability, still under use of resources, the community involvement ensures local monitoring and accountability of sanitation projects, as they can identify problems early and take corrective action without waiting for external actors, improving the effectiveness of sanitation interventions. The seventh importance is increased resilience to environmental challenges. And environmental challenges, we cannot avoid talking about climate adaptation. So communities that are involved in sanitation projects are better prepared to adapt to climate challenges such as floods and droughts. They can contribute local knowledge about how to construct resilient sanitation facilities that can withstand extreme weather, ensuring continued access to safe sanitation even during emergencies. There's also an element of environmental stewardship because when communities understand the environmental impact of poor sanitation, for example, water pollution, ecosystem degradation, they are more likely to adopt eco-friendly practices such as waste management, composting toilets, or grey water recycling. The eighth importance is building trust and strengthening governance. So when it comes to improved governance, community involvement in sanitation helps to build stronger relationships between local governments and citizens. When local authorities engage communities in decision-making, it builds trust and ensures that sanitation projects are responsive to the needs of the population. Accountability in governance includes engaging communities to ensure that government and service providers remain accountable to the people. Communities can demand for better services, transparency in project funding, and higher standards of delivery when they are actively engaged. So what are the goals of CLTS? CLTS aims to eliminate open defecation and improve hygiene practices through community-driven behavior change, rather than relying on external subsidies or infrastructure-based approaches. The main goals of CLTS include, number one, of course, elimination of open defecation. So the primary goal of CLTS is to achieve open defecation-free status in communities, or what we refer to as ODF status. This means ensuring that no one in the community defecates in the open and that everyone uses hygienic latrines. Open defecation is a major cause of disease transmission, so its elimination is critical for public health improvement. The second goal of CLTS is behavior change and empowerment. Through fostering collective behavior change, CLTS focuses on changing behaviors through a process of community-led realization about the dangers of open defecation. The approach encourages communities to take responsibility for their sanitation and hygiene practices without relying on external aid. And of course, this brings about community ownership and community empowerment to take lead in improving their sanitation situation, which also fosters a sense of ownership and responsibility. So the community itself, not external actors, drive the change, which of course will promote sustainability and local accountability. The third goal is to promote low-cost, locally constructed sanitation solutions. This often would be affordable to the community, as the community is encouraged to use locally available materials to construct latrines, making sanitation improvements accessible to even the poorest households. The focus is on behavior change and collective action, rather than providing expensive, externally funded infrastructure. The fourth goal of CLTS is sustainability of sanitation practices. So the long-term impact, in the long term, CLTS aims to establish long-lasting changes in sanitation behavior. By involving the community in every step, the goal is to create sustainable practices that continue after the initial intervention. The emphasis is on preventing a return to open defecation and ensuring that latrines are used, maintained, and improved over time. The fifth goal is improvement in public health outcomes, of course. So CLTS aims to reduce the incidence of waterborne and fecal-related diseases such as cholera, diarrhea, and dysentery. By eliminating open defecation and promoting better hygiene practices, the program directly contributes to improved public health, particularly for children under 5 who are most vulnerable to these diseases. The sixth is strengthening social norms around sanitation. So CLTS works to create new social norms that view open defecation as unacceptable. The approach relies on peer pressure and community solidarity to change sanitation practices. Once a community reaches ODF status, the behavior is reinforced through social cohesion and mutual monitoring. The seventh goal of CLTS is inclusion of marginalized and vulnerable groups. So CLTS promotes the inclusion of marginalized and vulnerable groups, ensuring that sanitation improvements reach all members of the community, including women, children, the elderly, people with disabilities, and the far-to-reach communities. It advocates for equal access to sanitation facilities and involvement in decision-making processes. The eighth goal is to promote hygiene practices beyond latrine use. So talking about hand washing and hygiene, while CLTS focuses on eliminating open defecation, it also aims to promote other key hygiene practices, such as hand washing with soap, safe water handling, and general cleanliness. These practices are, of course, essential for breaking the transmission pathways of diseases. And finally, we have building local capacity and leadership. So talking about local leadership, CLTS aims to build local capacity by identifying and empowering natural leaders within communities who can champion sanitation efforts and motivate others. The goal here is to establish strong community-led structures that can manage and maintain sanitation improvements over time. Okay. So just a bit of some background on CLTS and how it came to be. CLTS emerged as an innovative approach to rural sanitation in the early 2000s. And it was designed to shift the focus from infrastructure-driven solutions to behavior change and community empowerment. It was first developed in Bangladesh and has since been adopted in many countries around the world, particularly in Africa and in Asia. Okay, so CLTS was pioneered by a man called Dr. Kamal Kar, a development consultant working in Bangladesh on sanitation projects. And it was at that time working for a local NGO. During this time, Kar noticed that traditional sanitation programs, which focused on providing subsidized toilets, were often ineffective in changing long-term sanitation behaviors. The traditional approach to sanitation improvement relied on building latrines for people through subsidies, but this model often led to a lack of community ownership, poor maintenance, and the continued practice of open defecation. Therefore, Kar realized that building latrines alone would not eliminate open defecation, as people needed to understand the health impacts of action. So the core innovation of CLTS is the idea of triggering communities. The core innovation of CLTS is the idea of triggering communities to take action by raising awareness of the dangers of open defecation. During triggering sessions, communities are shown, pathways, and they're walked through the entire process. There's shame that is used and social pressure rather than subsidies that are used to encourage sanitation improvements. We will go through the key steps in just a bit. Just going back to the background, in terms of initial success in Bangladesh, CLTS was highly successful in Bangladesh, where communities adopted the approach and achieved open defecation-free status without any external financial support. This success led to interest from international development agencies, and the approach quickly gained international attention with UNICEF, with WaterAid, with Plan International, among other organizations supporting its rollout across various countries in Asia and Africa. Governments in countries such as Kenya, Ethiopia, Ghana, Nigeria, and India, Indonesia began integrating CLTS into their national sanitation strategies. And CLTS was introduced in Africa in the mid-2000s, where it was met with success in rural communities that struggled with sanitation access and where traditional infrastructure-led approaches had not achieved the desired results. So countries like Kenya, Malawi, Zambia, and Uganda have seen significant reductions in open defecation through CLTS initiatives. So why was CLTS needed? One can say that before CLTS, many sanitation programs were based on latrine subsidies provided by the government or NGOs. However, these programs often failed because subsidized latrines were not always used or maintained properly. Households receiving the latrines lacked a sense of ownership, and open defecation continued despite latrine construction, as behavioral change was not emphasized. So CLTS addressed these shortcomings by shifting the focus to community responsibility and collective behavior change. So by encouraging communities to identify the problem of open defecation and take action on their own, CLTS moved away from dependency on external funding and emphasized on self-reliance. So there are some key principles of CLTS. The first one being no subsidies for latrines. So CLTS deliberately avoids providing external subsidies for latrine construction. Communities are encouraged to build their own toilets using locally available materials. The second is triggering for collective action, So CLTS is initiated through a triggering process where communities are shown the negative health impacts of open defecation, leading to a collective decision to eliminate the practice. The third principle is inclusivity and participatory. The approach is CLTS is a participatory approach involving all members of the community, including women, children, and marginalized groups, to ensure that everyone contributes to and benefits from improved sanitation. And finally, the fourth principle is focus on behavior change. So CLTS prioritizes behavior change over infrastructure development. The goal is to change people's attitudes and behaviors towards sanitation, ensuring long-term improvements. So CLTS has quite a number of steps. It is a process and it is a methodological process. It follows a structured process to engage communities to foster collective behavior change and eliminate open defecation. The first step in CLTS is pre-triggering, and this step involves preparing for the community engagement and ensuring that facilitators are well equipped to lead the CLTS process effectively through, number one, community selection. So you identify communities where open defecation is prevalent and that are suitable for CLTS implementation. This selection can be based on health data, geographical assessments, or recommendations from local authorities. Number two, you have to understand the community. So gathering information about the community's social structure, leadership, and existing sanitation practices is quite key, as it helps in planning a more targeted and effective intervention. Then the third is gaining entry into the community. So here you need to engage with local leaders, whether it is traditional, religious, and or governmental, to get their support for the CLTS process. The backing is crucial for gaining community acceptance and mobilizing people for collective action. And then finally, you have the fourth step still under pre-triggering, which is training facilitators. So the facilitators should be trained in the participatory techniques, should be trained in communication skills and the principles of CLTS. The facilitators need to be sensitive, patient, and skilled in guiding community discussions. So that is the first step of CLTS. The second is triggering. So after you've done the planning, after you've trained your facilitators, after you've identified the community that you trigger, then you go into that community, and that is the second step, which is triggering. So the triggering phase is the heart of the CLTS process. It is designed to ignite a sense of disgust and shame in the community about open defecation, leading to immediate action and collective behavior change. Under this step, you have several sub-steps, including community gathering, where you call the community to a meeting. And this should include everyone in the community: men, women, children, marginalized people with disabilities. The presence of all segments of the community ensures inclusive participation and collective responsibility. The second sub-step is facilitating realization, which is really bringing out the shame and disgust. So using participatory techniques, you help the community to understand the negative impact of open defecation and on their health and environment. The goal is to create a sense of urgency to stop open defecation without lecturing or providing solutions. The key activities under the second step include mapping, where the community draws a map of their village, marking homes, water sources, and areas where open defecation occurs. This will help them to visualize the proximity of feces to their living spaces and water sources. There's also a transect walk, or the walk of shame, where facilitators and community members take a walk to observe open defecation sites. This experience is meant to trigger feelings of disgust as they see the extent of fecal contamination. And then there is another activity, which is a fecal-oral transmission demonstration. This activity demonstrates how feces can easily contaminate food and water, leading to disease. Often, facilitators use visual demonstrations like placing a hair in the glass of water to show contamination pathways. And then we have the calculation of fecal load, where facilitators guide the community in estimating the amount of feces generated by the community and deposited in the open daily. This is a powerful realization that often leads to a commitment to stop open defecation. So at the end of the triggering step, there normally should be a collective action. And this activity aims to build a sense of a collective responsibility, leading to a community decision to stop open defecation. The community should spontaneously commit to taking action to build latrines and change the behavior. The third step is post-triggering or action planning. So once the community has committed to stop open defecation, the post-triggering phase focuses on planning and supporting the community's efforts to achieve open defecation-free status. And here they should develop an action plan for construction of latrines, ensuring that every household has access to sanitation facilities. Local leadership should also form committees or designate natural leaders from within the community who will lead the sanitation efforts. These leaders can motivate others to organize labor and to monitor progress. Part of commitment should also be mobilization of resources, where communities are encouraged to use local resources to build their latrines. And there should also be continued facilitator support through visits to the community to provide technical advice, moral support, and guidance as the community works towards achieving ODF status. The fourth step is follow-up and monitoring, and this is through regular visits by facilitators, community monitoring systems, where you encourage the community to develop their own monitoring system, such as appointing ODF champions or setting up a system where community members can report non-compliance, and also through progress checks, where the community tracks how many latrines have been constructed, how they're being used, and whether they have any issues since construction, whether it is maintenance or structural. Then the fifth step is verification of ODF status. So once the community believes they have eliminated open defecation, external evaluators, often from local governments or NGOs, verify whether the community has achieved ODF status. So this includes a verification process through where you conduct thorough inspection of the community to ensure that one, no one is practicing open defecation. Two, all households have access to a latrine. 3, latrines are in use and properly maintained. And 4, hand washing facilities are in place and hygiene practices are improved or have improved. Once that is done, then there is certification. If the community meets this criteria, then the community is officially declared open defecation free. And this is often celebrated with the community at an event or certification ceremony, providing recognition of the community's collective achievements. Then 6, we have post-ODF sustainability. So achieving ODF status is not the end of the process. Ensuring long-term sustainability of improved sanitation practices is critical to preventing a return to open defecation, and this is done through continued monitoring even after certification and regular follow-up by facilitators. This is also done through improvement and upgrading of facilities over time, and also focusing on hygiene practices such as hygiene, hand washing with soap, safe water handling, etc. And finally, we have scaling up and replication. So successful CLTS communities often become motivators for neighboring villages or regions. Sharing success stories and encouraging inter-community learning helps spread the CLTS approach to new areas. and this will lead to scaling up at regional and national levels, where governments and NGOs can work together to scale up CLTS using lessons learned from successful communities to implement the approach on a broader scale. So that is not to say that CLTS does not have any challenges. CLTS has a number of challenges, the first one being sustainability concerns. So one of the criticisms of CLTS is that in some cases, while open defecation is initially eliminated, communities may revert to old behaviors if there isn't adequate follow-up or if latrines fall into disrepair. Then we have equity issues. Critics also point out that in very poor communities, households may struggle to construct latrines with their own resources, and CLTS's no subsidy approach may disadvantage the most vulnerable groups. And we have adaptation to urban areas. So where CLTS was initially designed for rural settings and its adaptation to urban and peri-urban environments faces challenges, especially where space and access to materials for latrine construction are limited. So there are a number of ways we can address the challenges faced in CLTS. The first, especially when it comes to sustainability of ODF. So after initial success in achieving ODF status, regular follow-up by visits by facilitators, community leaders, or government officials can help maintain the momentum. ODF champions or sanitation committees can be established within the community to monitor the continued use and maintenance of latrines. And you can also introduce incentives for sustainability, offering rewards or recognition to ODF communities for maintaining their status over time, which can act as motivation. You can also encourage communities to progressively improve latrine quality over time. So as economic conditions improve, communities can be motivated to upgrade temporary latrines to more durable, more user-friendly facilities. When it comes to equity and inclusion issues, vulnerable groups such as the elderly, such as people with disabilities or persons with disabilities, very poor people may struggle to build or maintain latrines. And this can be solved through targeted support for vulnerable groups. So while CLTS avoids blanket subsidies, targeted assistance can be provided to those who are genuinely unable to build their own latrines. This could be in the form of community support where neighbors or youth groups assist in construction, or through local government programs that provide materials or labor to the most vulnerable. Inclusive planning can also be applied here. So the facilitators should be trained to be inclusive in their approach and to involve all members of the community, including women and persons with disabilities. There should also be gender sensitivity, especially when it comes to latrine designs and positioning, and disability-friendly latrines should be promoted. In terms of quality of latrines, in some cases, the quality of latrines constructed during CLTS interventions may be substandard, leading to issues like collapsing. To solve this, technical support and training is very important, and guidance to communities on building more durable and hygienic latrines. So using locally available materials is important, but ensuring that latrines meet basic safety and hygiene standards is very crucial. And facilitators should be able to demonstrate simple improvements, such as better pit design, ventilation, and hand washing facilities to aid with that. And of course, you're also talking about the progressive improvement of these structures over time. In terms of behavior change and cultural barriers, which can be a challenge, where some communities have deeply ingrained cultural beliefs and practices around sanitation, making it difficult to change behaviors and therefore not fully embracing, the shame-based tactics used during triggering. A solution to this would be to tailor CLTS activities and messaging to fit local customs and beliefs, So facilitators should work with local leaders to understand cultural dynamics and adjust the triggering process to resonate with community values. Okay. There also is an issue with institutionalizing CLTS, where there is no sustained follow-up, communities losing momentum after achieving ODF status, and therefore governments should integrate CLTS into their formal sanitation policies and strategies. Government bodies or local health workers can take on the role of monitoring and support CLTS efforts over the long term, ensuring communities remain ODF. This can be done through partnerships and collaboration, e.g. engaging NGOs, local health departments, community-based organizations in follow-up and support activities. Okay. Adaptation to the urban areas as a challenge. CLTS was originally designed for rural areas. So where open defecation is more common and where land for latrine construction is usually available. In urban and peri-urban areas, limited space, higher population density, and complex land ownership issues make implementing CLTS more difficult. Possible solutions to this would include modified urban CLTS models, so adapting CLTS to realities of urban settings. This could include promoting shared sanitation facilities in dense areas or encouraging the construction of communal toilets where individual household latrines are not feasible. Partnerships with local governments in urban areas with municipal authorities to ensure proper sanitation infrastructure is available and maintained is also another way. And then the adoption or the encouraged use of ecological sanitation or portable latrine options is also an option, especially where where space is a constraint. Financial challenges that come with CLTS could be that some communities may expect financial support for building latrines, especially in regions where previous sanitation programs provided subsidies. A solution here would be clarifying the no subsidy principle. So during the pre-triggering phase, it is important to clearly explain the philosophy behind the no subsidy principle to avoid misunderstandings. This could also be done through supporting mechanisms without direct subsidies and introduce innovative ways to support communities without directly providing subsidies. And with that, I would like to say thank you for your time. I have come to the end of my presentation, and I'd like to hand over the session to Sheilah.
Yes, thank you so much, Susan, for that. We are happy that we are learning more about what CLTS is all about. I have quite a range of questions that I want you to help us answer. If you can be able to check the chat feature as I read out some of them. So the first question is from Moses. How can CLTS be effective in an IDP or refugee camp where there is restriction of movement into the host communities and are not allowed to move, get materials for their own sustainable latrine construction and tippy-taps constructions around the toilets? How can we make CLTS effective in an IDP or refugee camp?
Thank you for that. So CLTS can still be effective in an IDP camp by fostering community engagement and ownership in sanitation practices. So through community empowerment, CLTS would encourage residents to identify their own sanitation issues, leading to greater investment in solutions. Then there's also an element of behavior change by facilitating discussions about hygiene and sanitation. CLTS promotes lasting changes in behavior. Social cohesion is also one way to go about it by engaging communities in collective activities that strengthens their bonds and promotes collaboration amongst diverse groups. And CLTS can be tailored to this very unique situation by taking into account the context in which these groups are living in, the materials or resources that are available to them, the technical skilling or capacity that they possess, as well as space, because sometimes a big issue with IDP camps would be space. Lots of people cramped up in a very small space, then would sort of guide discussions around open defecation, where it is occurring, and what sort of facilities can be adapted to that context. I hope that is quite clear, Sheilah.
Yes, Susan, that's quite clear. And I believe that's the same thing that Emma was asking, like, how can you use CLTS to address the challenges and cultural sensitivities of refugee communities? Quite something that we need to also consider even as we move along. And I want to insist that, as you can see, we learn a lot about CLTS in our WASH courses. So do make a point to just enroll for that training, so that now you can also meet Susan and get to understand and appreciate what happens in the WASH sector. And then there's another question. How can we make our own hygiene promotion practice better beyond the latrine use?
Sorry, how can we make our own hygiene
promotion practice better beyond the latrine use?
So there's, the normal, just beyond the use of toilets, there's also personal hygiene that needs to be addressed. Talking people through why there needs to be, a personal hygiene routine for everyone in the household, how to go about it. Sometimes it might even lead to, demonstrating how you wash your face, how you brush your teeth, how you wash your hands, how you should bathe, cleaning innerwear, and hanging it out in the sun for it to, completely dry before using it. So such personal hygiene goes beyond just the use of toilets. There's, of course, the hand washing after the use of toilets, before food preparation, cleaning of food before preparation. All those are still part of hygiene that still contributes to the well-being of, your target audience. So it's an all-round approach that shouldn't just be focused on toilet use, because truthfully, there are very many pathways to disease contraction, and those are, we are all working towards that. So in any way we can reduce, for example, trachoma from, just simply cleaning your eyes every morning, then that is also taught.
Okay,
yeah.
Thank you for that. And Emmanuel is asking, how can CLTS initiatives support menstrual hygiene management in the refugee setting?
CLTS and
MHM, menstrual hygiene management. How can they support each other in the refugee setting?
All right. In the refugee setting, it is quite crucial to ensure that CLTS goes hand in hand with MHM to promote overall health, dignity, and community resilience. It's quite interesting because with the humanitarian context, especially now that we have the sphere guidelines, we are, advocating for access to hygiene products to ensure that women and girls have access to menstrual hygiene products. That is vital to their health and dignity. Then education and awareness is quite important, where, as you're doing the CLTS triggering, you're also, moving to, you're also ensuring that MHM education is integrated in this program, addressing any cultural taboos and promoting hygiene practices. And establishment of safe spaces can also significantly enhance the dignity for women and girls. So through a holistic approach of combining CLTS and MHM initiatives, this can lead to improved sanitation facilities that include adequate disposal options for menstrual products. And, it also brings about a situation where you explore sustainable solutions and build capacity within the refugee communities, ensuring that improvements in sanitation and hygiene practices are sustained over time. Thank you.
Okay, thank you for that, Susan. And for those guys who have questions, this will be a time for you to just raise up your hand. I'll take only 2 questions. because time has so much gone, and we are short of time in that case. So there's another question here from Simon. For countries you have mentioned, I think during your presentation, they have managed to achieve ODF. Was CLTS used as a standalone approach, or was it integrated with other approaches like sanitation marketing, MBS, and all that?
That's a good question. Yes, CLTS does not stand alone. There are quite a number of things that need to go hand in hand. And as you've mentioned, sanitation marketing is just one of them. So it is not a situation where CLTS was, just used as a sole approach. And over time, some of these other approaches that support CLTS have proven to be quite effective, because then it ensures that there is a supply and demand of certain products and services that also, of course, would create employment, economic activities, which is beneficial even to the community. So CLTS standalone, of course, would not necessarily work, because you're also talking about sustainability.
Okay, that definitely makes sense. I want to give a chance to Ruot. Susan, you can give rights. I think you're the host.
All right.
You can allow Ruot to ask his question. His hand is up.
Yes, am I clear?
Yes, you are.
Yes.
Yeah, thank you so much, Humanitarian Global, for the presentation. My name is Tom from South Sudan, and I'm currently in Maban, working with Relief International and in a wash settings. So I have just one question or clarification, like what could be really the period that people need to take while running a CLTS, or while trying to implement the approach of CLTS in a community, because we have been in community here for quite almost like 10 years, and the CLTS program, it's being implemented, but the changes are not really seen. And as the other point that you said, I marked one of the point, because this is a refugee context, and the accessibility of materials for the communities to construct their own latrines is quite challenge here. So like the duration for CLTS like to be seen, it's quite difficult. I don't know how we can address that one.
Thank you. Tom, have you finished?
Yeah.
Okay, great. Thank you for that question. I think there are two questions. So just on the first question, in terms of timelines, the implementation period for a CLTS program can vary widely based on several factors, including the size of the community, the existing sanitation practices, and even the local conditions. But just in general, and this, don't take this as gospel, because again, it depends on the context you're working in, and even your own internal organizational processes, okay? For example, procurement, if you're bringing in a consultant, that may vary with between organizations. So there are quite a lot of factors that would come into play, but generally, it should take about 1 to 2 months to prepare and to assess. So the initial community engagement, a baseline survey to understand local context should be maybe 1 to 2 or to 3 months. And then the triggering phase, and here I'm talking about one single community. So if you walk into or you plan on implementing a CLTS program for one community, so 1 to 3 months of preparation and assessment. The triggering phase should take about a month to allow for discussions and activities that raise awareness about sanitation. And then another 1 to 2 months for action planning for the communities to develop their action plans and to construct these sanitation facilities. Then you'd give it another 3 to 6 months to actually build these latrines and promote hygiene behaviors. And then the verification and sustainability would be between 1 to 3 months. So overall, the process may take anywhere from 6 months to even over a year for communities to fully achieve and sustain open defecation-free status, depending on their readiness and resources. Now, when it comes to the humanitarian context, luckily, because there already will be quite a number of organizations that would be engaged in resettlement of any displaced persons or in the development of these refugee camps, then you'd find guidelines such as the SPHERE guidelines and any other relevant policies, whether national or international, that come into play. And the main goal in the very first few weeks would be for these organizations to establish sanitation facilities. However, you find that because of its nature being an emergency, you might find that the facilities that are provided for are perhaps less than or are not able to adequately serve the population that is within the camp. And therefore, that is when CLTS comes in. So after we've already, just ensured that there's a basic access, very low but basic access to sanitation facilities, then you start encouraging these communities to start thinking through the new norm. Okay, so they've been displaced from home. Perhaps they were used to sharing a toilet, 2 people. Now they have a station where they're sharing 1 toilet, to 20 people perhaps, or to even 50 people. And you're now, talking to them and just having them understand that for now, this is what could happen. But in the long term, they need to think through, what happens if we are here for the next 2, 3, 5, 10 years? Yeah, are these toilets going to be able to serve us? Do we need to start thinking about short, mid to long term of us not going back and staying here? Of course, it has to be more gentle than that, to just first cushion them and then have them understand that, there could be a situation where you don't go back to where you came from. So if this is your new home, what do we do? What do we do in terms of facilities, whether it is water, sanitation, hygiene? What do we do? Again, CLTS would reduce the instances of diseases such as diarrhea and cholera, because more often than not, people who are displaced due to emergencies do not actually die from that actual emergency, but they die from some of these diseases such as diarrhea and cholera. So ensuring that there's effective hygiene promotion goes hand in hand with CLTS. I hope that is clear, Tom.
Yes, thank you. It's clear. I got the concept.
Thank you very much. Sheilah, over to you.
Great. Thank you so much, Susan. We truly appreciate the information you've provided for us, and we are learning a lot. I think CLTS is one of the very engaging topics that we need to really relook at. So I would want to invite all of you to join our diploma training so that we can learn more and everything that is surrounding CLTS and be able to appreciate what it encompasses in everything. So with that, I think allow me to end there. I know we would have wanted to stay here longer, but because of time, I am deeply sorry for those that have not been able to ask the questions. I will request Susan to be answering them as she types, so that now she'll be able to try as much as it can to answer some of the questions on the Q&A section. And please, if you have a question on chat, please remain behind so that now you get your answers there. And yeah. So with that, I think that marks the end of our webinar for today. Thank you everyone for joining. We will be sharing the presentation and the recordings hopefully by close of business tomorrow, so that now you can have it and be able to compare notes and refresh your mind to what you have learned today. A link has been shared on chat for anyone who wants to join our WASH program. Please make a point of registering there. And if you have a question, also just getting to know more about us, please check our website. We have all the information there that you can be able to learn from it. With that, allow me to end there. Wish you all a wonderful evening, a wonderful day ahead, and a wonderful afternoon from wherever you are. Thank you, everyone, and goodbye. Thank you, Moses. Bye-bye.
Attention humanitarian and development professionals. Are you looking to take your career to the next level? Then you've come to the right place. Humanitarian Global offers self-paced online courses designed specifically for you. With our comprehensive curriculum, you'll build your capacity in the most critical areas of humanitarian and development work. Our course offerings include monitoring, evaluation, accountability and learning, water, sanitation and hygiene, disaster risk reduction and management, food security and nutrition in emergencies, procurement and supply chain management, human nutrition and dietetics, maternal, infant and young child nutrition. With Humanitarian Global, you'll have the opportunity to grow your skills and impact the lives of people in need. Visit our website to learn more about our courses and apply today.
My name is Emilia Siafa from West Africa, Liberia. I work for a women's rights non-governmental organization. It's called Sister Aid Liberia, where I serve as the program director on women's political participation and leadership. The last 5 days of the training has been very insightful. I have been able to learn not just from the presentation, but I've been able to gather the information from all the participants on their different experiences and expertise on how they have managed projects directly and indirectly over the years. The information I've gathered from the training are very essential for me since I am directly managing project in my institution. I have been able to identify gaps here and there that I haven't really effectively been good at, or I didn't notice there were gaps, in fact, or they were important to managing the projects that I have managed. Moving forward, I have more information now. I have more ideas. I know new skills and techniques that I can incorporate as I go about managing projects, not just managing, but effectively managing projects for better results and impact. So far, so good. It was great. It was insightful and interesting. And I look forward to, being a participant of other future programs with this institution.